I have been concerned in a number of the Amerindian areas that a number of the birth control options that women had, in particular the injectables, that used to get at the village level, they're now told they have to travel to district hospitals, which costs them sometimes $10,000 to get there and $10,000 back. So those are my concerns in terms of access to services that are available. But in terms of the whole area of sexual and reproductive rights, I think we have made gains as a country over the years in terms of, I see Ireland just had their referendum, and I think it's very healthy that finally those issues are coming to the fore. But in Guyana, we were the second country after Barbados, and no other countries come after us in the Caribbean region. Nobody wants to touch the issue of medical termination of pregnancy. And at the time, we brought in what was a really progressive bill at that time, 1996. And so and what is an important lesson for us in Guyana is that it was brought about through bipartisan work. The women of Parliament on both sides worked to make it happen and got our parties to agree to a vote of conscience. And that's what made it through. I mean, the day itself, I thought I was going to die of anxiety, but because you didn't know really how people were going to vote, including even some of your own MPs that were not too happy about the issue. So we won that, and it's been there. And the issue of dealing with young people's access to information on sexual and reproductive health is important. The early studies that were done in the early 90s, the nursing profession was extraordinarily conservative and therefore did not want children coming in with, secondary school students coming in with school uniforms and looking for advice. That has changed somewhat, not as radically as I think it has, but there's a little more openness on it. I think the big things that Guyana did, and I haven't seen any statistics recently, and that worries me, and that is on the mother-to-child, prevention of mother-to-child transmission, which we introduced, and where we, I think, made a big impact in terms of reducing the transmission to children, and also the access to ART, drugs and so on. These are all very important issues. Sometimes I get a little bit worried now because I think there's a lot of more, how do you say, judgmental, religious judgmental issues seeping in. And that's my concern. We went through a lot of challenges because, there are religious views, there are cultural views on these issues, but nevertheless, we were able to try to keep above that on a clinical level and say this is access to services, people's rights. I'm getting worried now that I'm hearing more in the language and deportment of people that there seems to be this creeping religiosity that is becoming very judgmental of access to reproductive health, issues to do with homosexuality, sexual orientation, etc. And so those are my concerns now.